I've seen this interesting dissection and I wanted to share with you the contents. There is multiple structures here to identify that are relevant to the exam, and we can start from the top. You can see this interesting structure here that looks like the chiasm and the tract and the optic nerve, right? So you can see here in the front, this one is the optic nerve, and this is the optic chiasm, and that will make it to the optic tract. Okay, you can see also very close to the optic nerve, and we mentioned this before in the ICA course, the internal carotid artery course, that the terminal branch of the internal carotid artery is in close relation to the optic nerve. And obviously it will also give just under the optic nerve, it will give an artery before the bifurcation that's called the ophthalmic artery. So that will make it to the internal carotid artery. Okay. So the internal carotid artery obviously divides into two branches. One that you can see here, which is the middle cerebral artery, pointing laterally into the Sylvian fascia, and one that will point anteriorly, and that will be the anterior cerebral artery. I've mentioned this multiple times in previous videos. You have three branches that come from the internal carotid artery before the bifurcation, and these are the ophthalmic and the posterior communicating, and also the anterior choroidal. All right, so here we mentioned the ophthalmic pointing anteriorly, so that will make it to the posterior communicating artery. So this is the PCOM. All right, the PCOM is obviously communicating between the posterior cerebral artery, which is this one, so the posterior cerebral artery, and the internal carotid artery. So it's a branch coming from the internal carotid, pointing backward into the posterior cerebral artery. And we also know that the posterior cerebral artery is one of the terminal branches of the basilar artery. So that will make it to the basilar artery. All right. So you know the basilar artery gives two terminal branches, and these are the posterior cerebral arteries. And just before that, we'll also give the superior cerebellar artery. And in between them, there is a cranial nerve, which is the third cranial nerve. Remember, I always mention it as the man holding the cigarette. So the cigarette is the third cranial nerve, all right? And then obviously you can see this is pons, which I've used it to write the three branches of the IC on. So that will be the pons, or the basilar part of pons. Go back to the video where I explained the cranial nerves and how they come out from the brainstem, but you would find out that there is only one branch that comes from the posterior surface, and that will be the trochlear nerve, or the fourth cranial nerve. This big trunk you can find here is the fifth cranial nerve, and one coming from the midline at the lower end of pons, that would be the sixth cranial nerve, or abducent nerve. And then from the lateral side, you can see two branches coming together, and that will be the seventh cranial nerve and the eighth cranial nerve. This is called the intermediate, but I wouldn't worry about it. So seventh and eighth cranial nerve. And then you will find the ninth cranial nerve laterally, that's glossopharyngeal, and the vagus nerve, which is a big trunk, and this will be the hypoglossal nerve, which is coming from toward the midline. Remember the midline structure? We said the third, the fourth, the sixth, and the 12th. So third, the fourth is coming from the midline posteriorly, the sixth, and also the 12th nerve coming from the midline as well. So that would be the hypoglossal nerve. On the other side, you can see here, this is the accessory meningeal nerve, which obviously has a spinal origin as well. All right. So I thought I would share this with you, but it's quite an important one that usually come in the exam. To do a quick recap, we've mentioned this is optic chiasm, optic nerve, optic tract on both sides, internal carotid artery, given the middle cerebral artery, posterior communicating artery, going to the posterior cerebral artery, which comes from the basilar, and also give the superior cerebellar artery, and in between the third cranial nerve. Only one that comes posteriorly is the fourth cranial nerve. The fifth is a big trunk laterally. The sixth is a small trunk anteriorly. And in the midline, 7th, 8th, 9th, 10th, and 11th, 12th, and also the spinal accessory nerve, which is number 11. All right, thank you.